best thing about being a GP is the variety. Every single patient is different. Feeling a bit better? Ooh.
The hardest thing is the intensity of the workload, to be able to do the things the way you'd want to do them in the time that you have. I still think this is nothing to worry about, but there is a very, very rare condition that is more urgent that we get it seen.
I never come to work and think this is going to be a boring day, because no matter what happens, it's never the same.
I've dislocated my finger.
Were you trying to relocate it yourself?
So with those urgent referrals, they are referred on what's called a cancer 2-week wait referral. It just means that anyone that we're worried about with an unusual lesion, we want to see within 2 weeks' time.
Farnham Road Surgery, how can I help?
Sarah Brookman. Sarah? Hi, come through. I'm well. Thank you for waiting. Sorry about the delay.
That's okay.
How can I help today, Sarah?
I found out I'm pregnant.
Oh, wow. Congratulations.
Thank you.
Okay. So this is the first appointment that you've come in for.
Yeah.
So you are baby's dad?
Yeah,
I have to ask. Let's see. Okay. When was your last period?
The 6th of May.
6th May 16. When did you do the pregnancy test?
2 days ago.
That's positive. Lovely. So.
You're very soft-spoken, you know that. You're very like...
Is that a good thing?
That's a good thing.
I'm saying the 21st of February next year.
Okay, should we check?
Yeah, go for it. I want to bet on this.
Better fiver. Doctor's right.
Yeah. Okay, it says here the 10th of February.
Oh, damn it.
Don't worry.
I was out close.
And you are exactly 6 weeks today. 6
Wow.
weeks. Okay, and...
That explains a lot. I'm taking pain.
Have you ever been pregnant before?
Yeah. Yeah, I've got 3 children.
You've got 3 children. Any other pregnancies apart from the 3 children?
Yeah, I've had a miscarriage.
Okay.
I had that last year.
Any...
At Christmas. No, not last year, the year before, 2014.
Okay. So, this is the form that you need to take with you when you go for your scan, okay? Otherwise, they won't do the scan. So it's really important that you keep this one safe. Give them a call, and like I said, book the appointment for 12 weeks, so that's in 6 weeks from now. Book an appointment now with the midwife for your 8 to 10 weeks, so 2 to 4 weeks from now, and book an appointment for your blood test.
Brilliant.
And congratulations.
Thank you very much.
The only other thing I wanted to mention is there's lots of information about things that you can and can't eat in pregnancy. I'm sure you've had it all before.
No, don't worry. I've already been into the calf like, oh my God, I can't eat runny egg.
Yeah. But I can, so...
No, he can't. No.
Absolutely.
Brilliant.
Lovely. All right, then, guys.
Thanks very much.
Lovely to meet you.
Cheers.
All right, bye-bye now. Lovely to meet you.
Easy.
Bye-bye now.
In we come. Come and take a seat. How are we getting on?
I'm here for
The other injection.
the other injection.
How did the first one go?
Okay, it's been easier
That's
to move.
Steroid is a fantastic drug, but it can have short-term and long-term effects.
Yeah.
What does it actually do?
It's the best anti-inflammatory that we have. Really, it's better than all of those things like Nurophens and all the tablets you can take, which are anti-inflammatories. But this is a steroid type anti-inflammatory. The other ones are non-steroidal anti-inflammatories, and it's a fantastic drug. Except long-term use can cause lots of problems, including diabetes. Strangely, you can actually turn somebody into a form of diabetes with it. So I'm pleased that it helped.
Yes.
And you're happy for me to have another go?
Yes.
Fantastic.
Brilliant.
Good. I'll get it ready.
You're great, yeah.
Well, I hope this one's as effective as the last one. Prick now. Are we ready? All done.
Okay.
Brilliant. You're right, you can breathe again now. Well, you came up saying she was short of breath, and now, now she's stopped breathing altogether. Very good. Okay.
Yeah.
You can't do too many of these, as in, you know, you can only do 2 per shoulder per year.
Right.
Okay, so it's a matter of waiting and seeing how that goes now.
Okay. Thank you very
Lovely,
much.
well done. Good to see you too.
Thank
Let me
you.
get this door.
Good night.
Thanks very much. Always good. All the best. See you later.
Bye.
Cheers. Bye-bye.
You okay, my love?
I rang up this morning, prescription, Mr. Borovisky. I mean, I got a new hip, a new back, I need a new eye, a new nose, and new teeth.
Yeah, I'm a bit like that.
Well, bionic.
Come and see Hannah.
Hello.
Okay, so I understand we're worried about the left eye, is that right?
Yeah, but in the night time, it's very visible. But the daytime, when you try to see it, it's not very visible.
Where do you notice it?
It's a pupil, you know, the white spot on the pupil, left hand.
Have you got a picture?
Yeah, yeah. Easily you can see it.
Yeah, I see what you mean. Let's have a look. So it's on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think I see. It might, but not necessarily, because you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing when you're taking that picture.
Yeah.
So I'm going to write a referral.
Oh, all
So
right.
you should get something in the post.
Okay,
At
from
the
the eye specialist.
From the eye specialist, yeah.
All right.
And at the moment, I don't think we need to do anything else other than to get them to check it.
All right.
I don't think it's going to cause any problems right now.
Okay.
Okay, so
Yeah, we just worry about it.
yeah, which I can understand. Yeah, of course. Yeah, and the thing is, every time you're seeing it at night when you're checking the picture.
Nighttime is you can see easily, and
Yeah.
it seems like bigger.
Yeah, and otherwise we'll check again in 2 weeks' time anyway, because you'll have the appointment for the 8-week check, so we can always re-review it at that stage.
Yeah, yeah, because 8 weeks we're coming back.
Yes,
so-
exactly, to do the normal stuff and the immunizations and things.
Yes, thank you very much.
No problem. Okay.
Bye.
Take care. Sam. Initially, I thought this was going to be a routine referral, but there were a few factors that made me worry about the patient, even whilst I was initially consulting, which made me think actually I should look into this a bit more. Have a look at this. The way it presented was a bit different, and it made me wonder whether this could be something more serious and rare, like a retinoblastoma. Oh, hi there, it's Mustafa here. Hiya, I've just seen a patient, Hussein Khan. It's a 6-week-old. I'm just wondering if the parents are still in the waiting room, because I think they were going to get him changed. I just wanted to speak to them again. Retinoblastoma is a malignant cancer of the retinal cells of the eye. If it goes undetected, ultimately it can be life-threatening. Oh, actually, it's okay. Halima's going to go down and have a look for me. Thank you, bye. Oh, hi there. Are you able to put me through to the eye casualty? Oh, hi there. This is Dr. Suranji calling from Farnham Road Surgery. I'm just calling about a patient called Hussein Khan who I'll be sending to the eye casualty tomorrow with a letter. Thanks, bye. Sorry, I know you've gone and I've told you that, don't worry about it. But the thing that you said about the photo and noticing it in the dark night, it made me think about something. I still think this is nothing to worry about, but there is a very, very rare condition that is more urgent that we get it seen. So what I think I'm going to do is I'm going to write a letter for you to take to the eye casualty tomorrow.
Okay.
Okay? I still think it's nothing to worry about. I still think it's going to be something that is, even if there is a problem, they'll be able to deal with routinely. But there's just this one rare thing that can present with this thing about being more noticeable in the dim light. So I just want to double check on that. So I'm going to write that letter now. I'm going to give it to you in an envelope. So King Edward VII Hospital. So you go there, you pass on where the eye casualty is. Okay. Awesome. Okay, bye.
I got my cough back again, and it's annoying because it won't let me sleep.
I feel like I've got phlegm stuck across the back.
Chesty cough.
Productive?
What do you mean productive?
Coughing stuff up?
Oh, yeah.
I can't get it up, that's the problem. It's sort of here.
Oh yeah, I can hear it.
Just like stuck.
Take some deep breaths in and out, please.
In.
I can hear it on this side, left side.
Benjamin Pulsford. Hello there. It's Dr. Hyder. Come here and have a seat. All right, so you had a chest infection recently, didn't you? Yeah. How are you feeling? Is it
good, actually? I feel like the antibiotics are working. I haven't coughed badly in a while. I still cough every now and again, but last time I took all the antibiotics and I still felt a little bit of pain, and they said it was normal, and then it came back.
Right. Okay, all right. So things have got a bit better, but you're a bit worried that you're coming to the end of them because you don't want it to come back.
Exactly.
So they found this, like a cavity lesion with infection in it in the right middle part of the lung.
Yeah.
And it had increased in size, and there was like a fluid air level, so it looked like consolidation or infection. So because there can be a chance of this being something like TB, they recommend an urgent referral for you to see the specialist. A lot of people might think that TB doesn't exist in the UK anymore, but in fact it had never been eradicated, and it's only in the last 5 years that numbers overall have started to decline. So with those urgent referrals, they are referred on what's called a cancer 2-week wait referral. It just means that anyone that we're worried about with a lung unusual lesion, we want to see within 2 weeks' time to do further investigations. And you're very young, so I think it's unlikely to be something like cancer, but we need to make sure that it's not something like TB. Have you been exposed to anyone that's had TB?
None I know of.
We give babies and young children the BCG vaccination if we think they're living in an area where there might be an increased risk of catching TB. TB is more prevalent in areas where there's social deprivation, and it's important if you have any symptoms such as a cough, night sweats, weight loss, that you do see your GP, especially if you think you've been exposed to someone else that may have TB. Maybe that this is more of a complicated infection, like a pneumonia, that you feel a bit better from now, but we don't want to leave it alone because it's the second time it's happened, isn't it? So we want to get you referred. So it's a bit of an unusual chest infection that's been a bit resistant. The antibiotics you think are working.
Definitely working.
Yeah, I think I'll give you an extra week so you're not, you know, at risk of getting unwell in the meantime while waiting for your appointment.
So I need to make another appointment or not?
Well, it'd be good to see you after you've seen the specialist in 2 weeks to find out what's happening. If you're worse before then pop in sooner.
Thank you very much.
Take care then. Bye-bye. Hello.
Hello, I'm coming to claim my prize.
Oh, let's have a look. It's a big teddy.
Yeah. Oh, I should have brought a bigger bag.
Yeah.
Hi, come on in. How are you? How can I help?
For the last 2 weeks, I've kind of not been feeling right. I've been feeling really tired and drained and just bloated all the time and constantly going to the toilet. I had a miscarriage in February, but I don't think it came out. So about 12 weeks ago, I had a D&C and a laparoscopy.
Right.
And they removed something. Still not come on my period. Literally in the last few weeks, I could be sitting there and I'll just fall asleep, and that's not like me. I've got a 4-year-old, but I'm not doing anything over excessive or anything like that. And I don't know, I just don't feel right.
Have you lost any weight or anything?
In the last year, I lost quite a bit of weight, and then everyone kept saying, oh, you know, where have your legs gone? Where have your boobs gone? Where, you know, you're just shrinking. But now, it just feels like I'll eat something and my belly feels like it's out here.
Do you think your weight loss is related to your mood?
Not really. I'm quite a happy, positive person.
And what about your sleep? Is your sleep okay?
When I sleep okay. Living with my mum, my daughter sleeps in my bed. The flat isn't big enough for her to have her own room.
And what do you do for you? What sort of things? Is there any you time? Do you get any time?
Not really.
No. Is that because the little girl?
Yeah. Okay. Occasionally, maybe of an evening, my mum will have her and I'll go and stay at my boyfriend's.
Is there any depression in your family at all?
My mum suffered from depression. She was off work for quite a while with depression and anxiety.
Do you feel depressed, do you think, now?
No.
So how tall were you?
About 5'6".
So your BMI is just sort of 17 and a half, so that's underweight. It's quite difficult to get into this underweight category, actually, so that's quite significant. I think, you know, a lot of your symptoms are due to the way you're feeling psychologically, but they do have an effect on the way your body works and the way you feel about your body as well. So if you're feeling stressed and tired or feeling depressed, then it can make your body functions feel different, and you can have abdominal symptoms, you can have all sorts of other things that you might, if you're anxious, you might get fast heart rate, that sort of thing. So the mind has a big effect on how we feel about our body and how we feel it's working. What I want you to do is just do a urine sample. We should just do a couple of blood tests. Probably the most important one to do is the full blood count to make sure you're not anaemic or nutritionally lacking in anything, and a thyroid test, because if your thyroid gland overworks, you can lose weight. And then if we bring you back next week with these results, it'd be nice to catch up and we can go through that. Okay.
Thank you.
Okay.
It's when I cough, my chest has been pretty hurting along with walking as well.
Now the chest pain, tell me about the pain. Is it a sharp pain when you're coughing?
Sharp pain is literally centralised smack bang in the centre of my chest. It's just like, feels like a bang across my chest, really tight.
Okay.
Because I've had heart problems before.
What heart trouble again?
It's swollen ventricles.
Any sweating, nausea, vomiting, dizziness associated with the chest pain?
It's when I cough, I get a bit dizzy, and apart from that, it's just constant coughing, just chest pains, and it's restricted breathing, really.
Okay, jump over here for me. Let's check. Arm like this for me. Okay, now, I'm just going to have a listen to your heart, if that's okay.
Yep.
And take some nice big breaths in and out. And again. And again. Okay, come and grab a seat for me. Now, I mean, there's very good things. So the good things are, your temperature's perfect, your oxygen levels are perfect, your heart rate is perfect. However, the thing that concerns me is when anyone gets a tight pain on the chest, we need to make sure this is not related to the heart. Does that make sense, okay?
Yeah.
And the best way to do that is by getting a blood test done. That really should be done at the hospital because, of course, if that comes back as abnormal, then they need to action and make sure that there's nothing else worrying going on. Does that make sense? So I think that's what we should do today. I think we should get that done today, okay?
I'll have to swim past work first, though.
You should go there now,
Okay.
all right? You don't need to worry about work, because if you do suddenly develop, tight chest pain, you feel like you can't breathe, you're sweating, nausea, vomiting, dizziness, then that could be the heart. You call 999, you get yourself to hospital via an ambulance. Does that make sense? Take that straight up to A&E reception. When you go up to them, just mention that you've been sent by your GP for chest pain.
That's fine.
All right, buddy? No trouble. And make sure you go straight there now.
Mr. Tagala, please. I've got a medical student with me today, if that's okay. I'm Dr. Tawana. Nice to see you. So I think you spoke to one of my colleagues, something about bleeding from the back passage.
Yeah, that's right.
Tell me a bit more about what's been happening.
Well, I had a bit of constipation about 6 days ago.
Yes.
So after that, started bleeding.
Yes.
I really...
So with the constipation, let's just double check, were you really struggling to pass the stool?
I did.
Okay, and then after that, that's when the bleeding started?
That's right.
Okay, talk us through then the bleeding then. How's that been happening?
It was like, spray.
Oh gosh, okay. Into the bowl.
Yeah, bright red blood sort of thing.
Sure. And has there been any pain from the back passage at all? And when did it start?
It started on Thursday, I think.
Thursday.
Thursday.
Okay, Thursday, Friday, Saturday, Sunday, Monday, Tuesday. So 6 days now.
Yeah.
It sounds like, just from your description, the main problem here has been constipation. And as a very hard poo has been passing through and you're trying to push and squeeze, it's caused a tear, probably.
That's what I thought.
Not serious. Normally does settle by itself, but we need to examine you, if that's okay. So that does mean popping finger into the back passage, checking around. We're going to be looking for piles, anything else internally, checking for any obvious blood. And just give me a shout when you're ready.
Yes, I'm ready.
You're ready? OK, just bear with me. I'm just getting some of the bits we need.
Okay.
He gets terribly constipated. The only thing that's really sort of made him go at all was prunes. I tried everything else and there was no shift in him.
I've had diarrhea for the past 3 days.
Oh, okay.
Right, this morning it was like 6 o'clock, 6:30.
I'm fairly loose at the moment anyway.
Okay.
And last week it was jet black.
Yeah.
It's gone to a nice brown colour now, so.
I've been increasing my fibres, so now I can actually poo easily, so.
The trouble has been at the start very hard, like frozen peas, if you like, to it dripping out you like very, like milky chocolate, if you like.
Right, okay.
Let's take that through. OK. All right for me to come through? Yes. Yeah? Is it all right for our medical student to come through as well? Yeah. Yeah, is that all right? Thank you. I'm just going to pop the light on. Okay. The first thing we do is just literally just check in and around the back passage, making sure there's nothing we can find there. So just checking the back passage. And actually, a bit of a skin tag just on the outside there. Try and relax as much as you can. Cold jelly. Big deep breaths for me, in and out through the mouth. Any pain at all?
No.
No, OK, good. Normal anal tone.
There is a little.
There is a bit of pain. I think that's probably where you've got a bit of a tear. Yeah, OK, that's fine. Checking for any blood. There's no blood on the gloved finger. OK, pop your clothes back on and come round. Since the initial constipation, how have your bowels been? Has the stool
not
become...
very good, but
Is the stool a bit softer or not quite?
it's a little bit softer, yeah.
Fine, OK.
Probably I didn't, yeah.
So, no piles? Nothing serious that I could feel internally, nothing to find on the outside that's worrying me. It's definitely a tear, small anal tear that's been caused because of the hard stool that passed through and you probably strained to pass that.
Right.
There is no treatment needed for this. It will just heal up by itself.
Slowly.
Most important thing is to give you advice about trying to keep the stool soft so that you're able to open the bowels without the pain and without straining. So things like pears, prunes, anything that's high in fibre, plenty of fluids as well, those will all be quite useful moving forward to help the constipation. It should settle. I think it just needs a few more days. But of course, if you have any concerns, if the symptoms suddenly flare up, there's pain, then come back and see us.
All right. Okay.
All right?
Yeah. All right.
Thanks for coming in.
Sorry to bother you.
No, not at all.
I thought I'd just double check.
Best to get it double checked, yeah.
That's all right.
Bye.
Thank you.
Morning. So we're doing dressing on your hand, is it?
Yeah.
Okay. So did you have surgery or?
I had an accident, or rather, an argument with a tractor.
Oh, right. You had an argument with the tractor. Right.
The tractor one.
So sit here for me. I want your arm there, please, or your.
Okay.
Yeah. Have they kept
my wrist's
you in?
completely destroyed.
Oh.
It's held together with pieces of metal.
Oh, right.
I've been going to the plastics dressings.
Okay.
Because there's a
Okay.
Skin graft.
Right.
Basically along there. Oh, broken fingers.
Oh.
Broken fingers.
Not
destroyed
together
wrist,
with that.
broken rib, broken neck.
Anything else? Oh dear. Okay. That is all dry. It's just area open here, isn't it? Can you see it here?
Mm-hmm. Yeah. I think that's where they were putting the...
All this looks quite nice. Healed, you see. Can you feel anything?
Not really.
Uh-oh.
The wrist is definitely stiff and painful at the moment.
You should cover with the painkillers because don't suffer with pain.
It's just uncomfortable rather than painful.
Okay. Now the iodine needs to heal this open wound, you see. You've got very much pain, so I want to be very, very gentle
That's
with
fine.
you. Then I shall bandage it, okay? Give me your left hand just on that little side. Okay.
Okay. Thanking you.
No problem.
Okay, so another appointment for next week?
Shall we do Thursday again?
Thursday sounds fine.
All right, nice seeing you. Take care.
Thanks very much.
Bye-bye. Oh, solid sweetheart. This was I love. Oh, God. I thought I was going to choke on that then. That's what. You okay? Yeah, I need a drink of water. I can feel it here.
What can I do for you?
The reason I've come over to you is I broke my finger.
Right.
It was very swollen, so I thought to myself I've dislocated my finger. Waited till the swelling went down.
Yeah.
So I came
Were you trying to relocate
yes,
it
because
yourself?
I've done it in myself once upon a time. So I thought, I can't do that. Now, the hand was fine, but it's swelling, and I am concerned about the swelling. It doesn't come out until the 14th of June.
Okay.
I take the sternum pin out.
Yep.
Now, swelling there, and it's very sore here.
So you're feeling more pain now than you were feeling?
Yeah, and it burns. It gets very hot.
Yeah, and I suppose our worry is if you ever get some infection in there, that could be nasty. I've seen people with all sorts of pins sticking out of everywhere, really, with these sorts of things. But it's quite impressive, isn't it?
It's very, very impressive. Well, I can take this off when I'm sitting down to relax the hand.
Yeah.
But then I have to put that on when I'm in bed because you know how you turn in bed and you want, there's a hook. It's like a hook and it catches. Now, they give me an antibiotic because I'm allergic to penicillin.
Okay.
So the only one they had was terramycin. I was like a womble. I couldn't understand why I was feeling so giddy and really giddy and stupid.
Okay.
And I looked on I so happened to say to myself, well, read the leaflet.
Yeah.
And it said that it interferes with your blood pressure tablet, the amlodipine.
Okay, yeah. Whenever we prescribe antibiotics, we should really take a good look and see what other medications people are on, particularly because some antibiotics will cause problems with other medications that people are taking. In Mary's case, I think some of the antibiotics she was taking led to her blood pressure tablets becoming more effective and dropping her blood pressure. Should we try something else?
Yeah.
Let's go for old-fashioned erythromycin. Eh? You
Yeah.
need to be careful and see what it's like when you're taking it.
And not take the statin when I'm taking the antibiotic.
Don't take the statin.
Thanks so much.
No trouble.
If I could have killed myself, I would.
Yeah, look what happened last time.
What time are you on till? 6:30? 4:30? 5? Is that half day?
No, I've been here since 8:30.
I went to the other one at 8 this morning and then here till 8.
Look at any easier. Stick that on there.
Right, come and have a seat, Thelma. So, what are we doing today? Remind me.
Well, I'm terrified. You've got to give me an injection.
All right, okay.
On there.
So you're going for some surgery or other,
Yes,
are you?
Thursday.
What surgery are you going for, Thelma?
Ah, the worm again. Because I keep bleeding, don't I?
And your chest is okay. Just so saying about your asthma review. Is your asthma all right?
Yeah, I seem okay with
Yeah.
the old breathing, yeah. I just felt a little bit tight.
Tight?
Yeah, because
Yeah.
I can't bear to wear a brassiere. I don't wear a bra.
Mm.
Oh, look at me, brassiere.
Brassiere.
I don't remember the last time I said that.
Brassiere,
I'm thinking of my mother.
You're talking about
Yeah, bra.
girdles next.
Yeah,
girdles and
Oh, I used to wear them as well when I was young and slim. I don't know why. I need one now. But yeah, I cannot bear to be restricted.
Yes, yeah.
I can't wear a bra or anything now as I'm getting bigger and older.
Good, good.
Definitely not.
Okay. Right. So what we normally do is give it in the stomach. Okay.
Yeah.
So we just pinch, jab. It's a bit stingy. It's a bit stingy. Is it? But it shouldn't be painful. Just a bit of a sting more than anything else.
I don't like injections. The worst one is when you do there on the finger. Set on my own bloody doodah. Let's get some skin, shall I?
That's lovely. That's lovely. Well done.
Is that it?
Yeah, that's it. But as I said, because it.
Do you know how much I've been dreading this?
Because it
since
does the job.
Thursday?
Because
I swear. You're amazing. That is amazing. That's better than the R&R.
But because it does the job that it's doing, you can get quite a dark sort of bruise
Doesn't
there
worry me.
afterwards. That's it. That's done. Okay, lovely. So you've got those appointments booked. That's fine.
Yeah.
And yeah.
Is it you tomorrow, 12:10?
It is me again tomorrow.
It is. That's
okay,
lovely.
So,
You're an
yes. All right then. So you know not to worry next time.
I know. Well, I've got to run in it tomorrow. I won't have sleepless nights. You're an angel. Thank you.
All right then. Take care.
Good day.
Bye bye.
We said green was the colour green. Why can't it be diddly dubs?
Dibbly dabs.
Yeah, the colour diddly dubs.
Dibbly dab.
Yeah. Why can't that be a new Jimmy Flake, which is when I'm can't remember. Yeah. So why can't this be a donga? Yeah, and why can't that be a flower? Who thought of names for things? Come on, I want to know.
Can I have a seat? Hi.
Talk about that throw last night and bloody hell.
Okay, so the amylase that we were testing, the normal range is about 28 to 100.
Amylase, what's an amylase?
So amylase is a marker that we use to see if there's problems with the pancreas.
All right.
Okay, and if it's under 100, then we're usually quite happy, and yours is 933.
Jesus.
Yeah, so if it's that high, we wonder whether the pancreas is inflamed, and that can be related to the alcohol as well. And it's the same message, really, isn't it? Because, I mean, I know when I first met you, you did really well because you got yourself down to about 6 cans, right?
Yeah, I went down to about 4.
But then I spoke to you, when I spoke to you in November, you were telling me about the same, right? You were telling me 4 to 6 at that time.
Yeah,
So
yeah.
I think you've done really well where you are, but I still think you need a bit of extra help. Hugh, I've seen quite a few times, and many of those times I've advised him to go to a specialist unit for his alcohol dependency. The reason for this is because he will get more intense support. It will be much safer for him because he'll get advice about how to reduce his alcohol safely and not too quickly, which can be a risk to his life. They're there to try and help you with practical ways to get you off. And if your head's in the right place, they also can arrange community detox. So that's where you go through a prescription to completely stop and be able to do that safely without then fitting.
See, I just, to be quite honest, doctor, I don't want to be going in as somebody telling me what drinking does and what drinking does, you know what I mean? I feel that I can do it. I don't need it. I feel I can do without it.
He needs to make that choice. So it's often our frustration is that we will make recommendations to patients like you, but not until they're ready will they actually go. You know, your situation is that you don't have much choice really in that sense, because the risks to your health and your life really, because you're at that stage where we know you've got cirrhosis. We can see from your blood test that your liver is really stressed. You know, really stressed with this. Physically, your body's saying we need to get to a stage where you stop. So the bottom line is we've got to address it.
Alcohol. Drink much alcohol?
Depends if I'm going out on a weekend, I'll have a drink with my friends.
How much alcohol are you drinking at the moment?
Probably about 2 pints a day.
You smell of alcohol. Have you been drinking?
Yeah, I've had 2 drinks today.
2 drinks, yeah. Do you drink the whole day?
No,
I do drink a lot sometimes.
Okay. When you say a lot, what are we talking? A whole bottle of something, or is it just...
Well, I'm with friends, so it's hard to say.
Have you tried to cut down?
I don't need to.
Where you are at the moment, you couldn't just stop like that because you'd be at risk of fitting and that could, risk of death, right? And I don't want you to do it unsafely. I don't want you to walk out here and then just stop completely and then, could go through the shakes and have fits and stuff, because that's a risk as well. It is possible to die from the withdrawal effects of alcohol, especially if you're a dependent alcoholic. If you're a heroin addict and you have a withdrawal, you won't die. Whereas if you're an alcohol-dependent patient and you withdraw just like that, then there's a risk to your life. They might have an alcohol withdrawal seizure, and as a result of that, they could swallow their tongue and be unable to breathe and then die.
And you haven't forgot about this, doctor?
Can I have a look? But you know what, we could probably do it today if you want.
Yeah.
All right, and then we'll get you up here. All right, so you're just going to feel a sharp scratch coming down, okay? Just want you to stay nice and still for me. All right, that's the worst bit.
Okay.
Can you feel anything sharp there? No?
No. Bleeding a bit, yeah?
Yeah. It's because it affects the liver, it makes clotting factors to help clot. When I removed Hugh's wart, it bled a lot because of his chronic liver disease. It's bleeding away on us. Yeah. His liver doesn't produce the clotting factors that you need to be able to stop a bleed from happening. I think we might need a gauze to start off with.
I think it's coming down by the eyebrows.
Yeah, it is. Any time that you might have a cut or an injury where you might bleed, whether it's internally or externally, you have these clotting factors that will stop that bleed from becoming life-threatening, whereas a patient with liver disease doesn't have that ability anymore.
It's like cauterizing it, or...
Yeah, effectively, yeah. All right, round 2. As long as we don't get any blood on your shirt or your jumper, we'll call it a success, shall we?
Don't worry about it.
You okay?
Yeah.
You're slowly winning.
I'm not.
Well, that was a lot harder than I was expecting when we started.
Should have been 2-minute job.
Yeah. We spent more time on this than we talked about the really important stuff, isn't it?
Yeah.
Cheer up, ladies, ain't that bad.
How are you?
Not too well, I need your help.
Just take a seat. And what can I do for you?
Right, I'm experiencing bad heads, dizziness, the pain in the head. It's like, have you ever bitten on an ice lolly?
Yes.
Right, well, that's how I describe it.
So when you say dizziness, do you mean the room spinning round?
Not exactly. And when it's bad, Doctor,
The only I have to describe it like this is when I'm drunk. Well, I've never. I don't.
But you feel?
I have been in my young. But that's how to describe it.
Is it there all the time?
At the moment, yes.
And so, say if you're sitting down and you turn your head or look up,
then
that, okay. All right. Good, that's fine. And you have a discomfort behind your eyes as well?
Yeah, behind the eyes. There. Yes, you got it. Oh, dear, yeah.
Sorry, yeah. Is it tender if I press there?
At the back.
What about here?
Not so bad.
How's
They
that?
are.
Bit uncomfortable?
Yes, yeah. Oh, dear. What is the matter with me?
Well, wait until I finished, yeah. Right. Just look at my finger and just follow my finger across. Good. Just follow it up. Down. Good. Now, I think this is crystals in the wrong place in your inner ear, and you don't know where you are, so you'll feel unsteady. Now, what we've got to do is we've got to manipulate your head and your neck so that the crystals get back into the right place. You're the last patient I have, so I can spend that time with you if you wish.
I do wish.
Okay, good, okay. So, what you need to do, you want to put your bottom there, so you're sitting up straight, okay? But just come right back with me now, that's right. So what I want you now is turn on your left side. I'm going to hold on to your head. You've got to move your body round to the left side. Look at my forehead. Keep looking at my forehead. That's right. Good. Good. Well done. And I'm going to hold this here for about 30 seconds, okay? And then we'll just do it once more, okay? How are you feeling now? How's your dizziness? I'm just going to move. Good. So just sit up for me now. Just take your time. Good. How are you feeling?
Oh, yeah.
Feeling a bit better?
Yeah, you're just...
Is it amazing?
It is.
It is, yeah. That's called the Epley maneuver, okay? Just stay there for a few minutes. Just recovering from that, okay?
Yeah.
Good. So, come down. Good. So that's all we need to do.
Okay.
And then you tell me in the next 3 or 4 days how you feel. Okay. And if it comes back, let me know and we'll repeat it again.
Thanks for seeing me.
That's so nice to see you. Yeah. You take care. Bye.
Thank you very much.
Okay. All right. Bye.
Bye-bye.
Take care, and I'll see you in a few weeks, yes?
Thank you so much.
Okay, see you later.
Bye.
Bye-bye.
Thank you. Darling, take us in the waiting room. She'll be with you shortly.
Ouch. That's it.
Because we are wondering about the possibility of leukemia, that means we have to move quite quickly.
So he has an infection in his chest, but he's also a bit heavy.
Am I feeding him too much?
I think so, yes. I think so.
If the same gets prolonged for more than 30 seconds, then sometimes some people have sudden cardiac death as well.
Had you had any suspicions about your hearing?
Oh, I'm fed up with asking people, what did you say? What did you say?
They can book you in for a blood test.
Another blood test?
Yeah.
I'll have to come in for a transfusion, I will.
Chelsea Pierce. Hi. Come through, have a seat.
In the last 2.5 months, I've been on 2 different types of contraceptive pills, and they've constantly made me bleed. And the last one that I was put on, I stopped about 2 weeks ago. It made me bleed even worse. I'm still bleeding now, and it made my moods really bad. And I was taking out my partner all the time. Like, I was shutting myself in my bedroom. So I was just wondering if it would be possible if I could try the contraceptive patch.
Okay.
I've been on 4 different pills now, and I've had the implant done as well, and they've all done the same thing.
When did you have your baby?
She's nearly 4 months old.
Are you breastfeeding?
No.
Planning on having any more soon?
Not for a few more years, no.
Okay. So you've got the pills that you know about. You've got the injection.
Yeah.
You've got the implant. You've also got the coil.
I can't have the coil. I've got 2 wombs and 2 cervixes.
Okay, that might be a problem. That might also explain why you have heavy bleeding. Did you have heavy bleeding prior to starting contraception as well?
My periods were normal because I had an operation in 2013, and that's when I found out. But previously, before that, they were fine.
Okay.
But now that I've been on the pill, they've just seemed to make it worse.
So today we're looking at your fingers. Which one's the one that's causing you the problem?
This one.
How long has it been a problem for?
Forever.
Forever. And tell me what happens to it.
When I fold it over,
Yep.
it locks.
Okay. And where do you feel that's catching?
Just in there.
Yeah, strangely, it probably isn't. It's probably further down here that it's causing the problem. So, and in fact, you can feel a little nodule in there. This is called a trigger finger. And what happens is that you've got muscles in this part of the arm that end up in tendons that go and insert into different parts of this. And they contract these muscles and it pulls the fingers down.
Okay.
Now, for these tendons to work, they have to go through little sheaths. And sometimes what happens, you'll end up developing a little bit of inflammation inside there, a little nodule forms. And as it goes through the sheath, you pull it down and it gets caught, and it's harder for you to open it up again.
Yeah, that's it.
Okay. What we could try to do for you is pop a little injection in here that sort of sits between the tendon and the sheath. And it's a little steroid injection. And the idea is to reduce any inflammation that's there and allow that to settle down so that it works properly.
Okay. Will I cry?
Hope not.
The patch is an option to try, but it contains the similar type of hormones we just gave you now.
Okay.
There's lots of different pills we can try and things, and so you've just had the combined pill. It's a mixture of estrogen and progesterone, and that's exactly what the patch is.
Oh, okay.
When you first had your baby, you were just given progesterone only. It's that particular hormone that can have an effect on your bleeding pattern.
Oh, okay.
And the trick is we need to find a type of progesterone that's going to work for you. So I'm going to try you a different type of pill. And you haven't had this type of progesterone. It's one of those ones that we would use if we were trying to stop bleeding. Hopefully it will have a better effect, okay? But again, if it's, see how it goes, give it a month. If it's not working, you need to come back in.
Okay.
We will get there, Chelsea. Okay.
Fingers
All right,
crossed.
good. Fingers crossed. Exactly. All right, but like you said, give it a month. If it's not helping, come back and we'll see what we can do. Okay.
Thank you very much for your help.
No problem. You take care.
See you later.
Bye bye.
Getting all nervous now.
Okay, just pop your hand up here for me. That's good. I'm just going to give that area a bit of a clean. Right.
Oh, I'll have to look away.
That's absolutely fine. You look anywhere else. Okay, a little prick now. Well done. Well done. Put that on there.
Yeah, I felt that.
Sorry?
Felt that. It's making me sweat.
Okay, so that's done. So what I suggest is over the next few days, just take some Nurofen or something like that just to try and help if it's painful. If in 6 weeks' time you feel that it's no better, then give me a call and I'll get you back in again.
Okay.
Okay?
Thank you very much.
Okay, mate?
I'll wipe my forehead now.
See you later.
See you later. Thank you very much.
Bye-bye.
Can I have your pen? No. Oh, yeah? It's a cool one, too. Why don't I get nice pens like that?
Hi, Michael. Come on in. Take a seat. Nice to see you. I haven't seen you in a long time.
Been having a lot of problems, still.
Okay.
back here to find out what the results were from the blood.
Yeah, you had some blood tests, didn't you? Okay.
3 times spike and white blood cells or something.
Yeah, that's right. And you mentioned that you've been feeling unwell.
Yeah.
Tell me a bit more about that.
Last week it's been awful. I keep dry reaching. I'm just eating toast and drinking lots of fluids. I'm not going to the toilet at the same time though.
Okay.
It's just stomach reflexes, dry reaching. There's nothing coming out except just pile water, you know.
Any other things that you've noticed? So the dry retching.
I'm constantly tired and I can't sleep. I can't. I probably had 2-3 hours of sleep a day.
Yeah.
I have this weird rash that's appeared all over my body.
Yeah.
My legs and everything is, but they don't know what that is either.
Right, okay.
There's a lot going on, there is, you know, but they just can't get it all. It's all around me, stomach and everything is.
All right. With the symptoms that you're describing here, Michael, and I think when you saw Dr. Lee, you mentioned that there was a family history of a blood cancer, so leukemia.
Yeah, my sister.
That was your sister. That's something we need to keep in mind because actually the results have come back. And if we tie in your sister having had leukemia, the kind of symptoms you've got at the moment, and your blood results which show that your white cell count is a little bit raised, we do need to be looking into getting this checked out in far more detail than just a blood test. So the next step would be getting you seen by a haematology doctor, that's a blood doctor, to ask the question, what could this be? Why has Michael's blood cell count, why has that gone up? And letting them know that there is this family history of leukemia. And I would also want them to know that you've got this collection of symptoms, tiredness probably being the main one, which may tie in with potentially something like leukemia.
Cheeky boy. Hello, what are you doing? You're not going to smile at the doctor today, no? Cheeky boy, aren't you?
And who's this?
What's your name?
Your big sister.
Brother, sorry.
That's the hair, isn't it?
It's your long hair, it's lovely.
It's
okay. Right, hold still.
No. It's all right. You're a brave boy.
Look at his face. He's having us on, aren't you? Cheeky boy. Good boy. Cheeky. Come on. Cheeky bum. Oh, you've been sick.
Darren Davis, please. Hello. You're 3 now, are you? Oh, you're getting a big boy. Right. Hello, you've got 2 of us today.
How are you?
He's 3.
3.
So my name's Julie. This is Andrea.
That's my mummy.
That's your mummy. Yeah. So because you're a big boy now and you're going to nursery and soon you'll have to go to school, won't you? To big school.
Yeah.
Yeah. So because of that, we have to give you some little injections. Yeah? So one little injection goes here and one little injection goes there. Okay? It's just a little ouch. Yeah? Very quick. And then we'll get you some stickers. Yeah?
Yeah.
Yeah, you like stickers?
Yeah.
So you're going to sit with Mummy and be a brave boy? Just leave that there for now.
Superman.
Wow, Superman! You got muscles like Superman? Whoa, big muscles! Mummy's going to give you a nice big cuddle. Okay, so you're just going to feel a little ouch. Okay, nice and still for me, darling. Oh, sorry. Little ouch.
Ouch.
Good boy. I know, sorry. That's it, that's it. That's it. That's it. Good boy, well done. Right, one more little ouch. That's it, good boy. All done. That's it, finished. No more. All finished now. Good boy, well done. That's it, all finished out. So you can give him some paracetamol, some Calpol when you get home.
We can't take that off yet, Darren. We have to take it off later.
If you want, that's fine. Do you want to take it off? Take it off. That's it. You want to do it, shall I? That's it. That's it. There we go. And this one. That's it. I'm sorry, you didn't like that, did you? There we go. That's it. It's all fine now. You're all done now. You don't need any more. You're all finished.
Now? Do you want your sticker now? Where do you want to put it? Yeah. There it is.
That's it. That's it. Brave for the nurse.
You've got one.
You want the whale one? Did you want the whale one instead? All right, you can have 2 then, because you had 2 injections. Yeah?
What do you say?
There we go.
What do you say?
All right, good boy.
Right, can you sit down then?
All right then, bye-bye.
Thank you. So have a nice day.
You too, bye.
We cannot say for sure that that's what it is at this stage. We are probably just getting a hint that something's not quite right.
Can we get this done quick?
Yes, absolutely. So because we are wondering about the possibility of leukemia, that means we have to move quite quickly. When we deliver potentially serious or bad news to patients, it's extremely important to be very clear in your communication, to recheck that patients have understood what you've told them, and to actually give the patient some time to absorb and understand what it is that is being discussed in the room. You will get contacted by the hospital tomorrow, and they will arrange to see you, and an urgent on the NHS means that you get seen within a 2-week window. You would then see a specialist, a haematologist, okay? They would then have a look at this, decide what the next steps are going to be in terms of assessing you, any further tests that they need to do, and it would start the ball rolling.
Okay.
Okay. I know it's not the easiest thing to hear from a doctor. At the moment, we don't have a diagnosis.
So we just have to wait and see until hematology
We do need to get this looked into, yeah. And so, of course, I'll arrange that urgent referral today.
What do we need to start doing to make this better?
So I can't advise you on that, Michael, just because we don't have a cause for this yet. We haven't made a diagnosis. Say we find a reason why you're feeling this tired, that's going to allow us to then work out how best to manage it and treat it for you. Okay, Michael?
Do we need... I just have to wait for the letter from the hospital, really?
Contact from the hospital either tomorrow or on Wednesday, and they will make you an appointment to see a specialist, and that's all done in a short space of time, and we go from there. All right. You're welcome.
All right, Doctor.
Take care.
Oof, got a headache. Honestly, I think it's these lights.
It is. I get a headache every day.
I need to bring my sunglasses in.
Sit
here with my sunglasses on.
Your sunglasses.
What's the latest, mate?
I'm still having problems with my head. I'm getting really severely depressed. The drugs I'm on are not really helping. The only reason I really get up in the day is because I've got a dog and the dog kicks me out of bed. You know, it bites me to death. So
Do you want to change your antidepressant?
Well, if it's not working, is it?
I know, but there's a limit to what any of them might be able to do, David. Do you know what I mean? That's the problem.
Well, yeah, but even my painkillers don't seem to be working, or maybe it's just because I'm feeling so low.
I think that will be part of it. Okay, so we'll change it around. Okay, so we'll change you to a. So you need to stop the fluoxetine.
All right.
Okay, which you're taking 2 of at the moment. Then start with just one of these ones. Okay, and we'll see you in 3 weeks.
I mean, drugs will only do, as you say, do a certain amount. Maybe I should go on a cannabis or something. Yeah. I'll send you a bit paranoid, innit?
Can in some people. My son's about to go off to Amsterdam for.
Oh,
with his mates. Can't wait to
What, a
see
rugby
what
talk?
happens there. No, just yeah.
Right, well, I was going to say, Joyce has wrote this out. Can we have 2 months' supply of it?
Yeah.
You know, when I come to see you, I don't come with 1 or 2 little things. You should know that.
Mate, I know. I should have put you
I
in
mean,
for
you
a
walk past
quadruple appointment.
with a bloody mug in your hand with some liquid in it. You didn't even offer me any, you know?
No, I didn't. No, because it's bad for you.
Yeah.
That's your medication.
No problem. I'll see you if I come back.
Why, you why?
Yeah.
Where are you going?
Spain.
Okay, mate. Enjoy yourself, yeah?
Yep, no problem. And
You probably will. I mean, you know, it's probably the best thing for you to do at the moment, just to get away.
oh
and,
yeah,
you know.
just chillax and
Yeah.
I mean, it's only 35 over there at the moment, so it's down the beach in the sea. I find it more, I don't know, maybe it's better in swimming in the sea than I do in the pool.
So salt water makes more point, mate.
Yeah, that's it. You know what I mean? I better go to the Dead Sea then, hadn't I? All right, Davey boy. Yeah. All right.
I think I need glasses because sometimes, you know, like if I'm looking at a prescription, I'm like this.
Yeah, it gets all fuzzy.
But they said to me, no, your eyes are fine. I have to get a pen and hold it this, look at the top for 3 minutes, then look away.
What?
And then bring it closer and look away. I thought that's not going to bloody work, is it?
Yeah.
I'll be ended up with eyes like this.
What size?
Hi.
Joseph Case, please. Okay, have a seat.
Thank you.
Okay. How can I help?
It was two things, actually.
Yep.
One, I'm on sertraline, and I was wondering if that could just be bumped up.
Okay.
I'm fine on it, etc., but just lately I'm just a bit edgy and stuff, so there's just that. And the other thing is I had a hearing exam. I can't afford hearing aids, so I've been told I've got to present this to the doctor and then you've got to refer me.
Had you had any suspicions about your hearing?
Oh, for a long time.
Really?
Yeah, I'm forever asking people to, you know, what do you say? I'm looking at them more and watching their lips a lot more because I run a youth club.
Oh, right.
And so a lot of background noise really interferes when I'm trying to talk to somebody.
Yeah. That's the type of hearing loss more common as people get older. Sort of in a crowded situation, the one-to-one conversation. So obviously with what you do, you must be having to do a lot of that.
Oh, there's a lot of background noise.
Sure. What? How long have you been doing what you do?
About 10 years.
Right.
So I've just
What's the age group that you have?
From 5 to 18.
Oh, right.
But you know, it's good. We have about 80 in on a Friday.
Yeah.
Maybe about 40 on a Tuesday, so it's busy.
Busy, yeah.
Busy.
Okay.
So there's a lot of noise going on.
I always think of like a Grover and things like what you do.
Right.
But obviously, that's how realistic that is.
Well, it's not too far.
That brings back memories.
Yeah.
So you've noticed. So you felt this change over how long?
Oh, over the last few years.
And what made you sort of in the end go to someone?
I'm fed up with asking people, what did you say? What did you say?
Yeah, that's fine. Hearing loss affects more than 10 million people in the UK, which equates to 1 in 6 of the population. Having one-to-one conversations can be difficult, and so often there may be situations where patients will avoid trying to engage in conversation, or they may find themselves pretending that they can hear everything and then finding themselves in an embarrassing situation. And unfortunately, it can lead to isolation, depression, and mental illness. Have you had any dizziness?
No. I've given up smoking, etc. So I still have a few coughs and stuff. And sometimes I cough and I get really giddy. And then after a couple.
Any other unusual sounds?
No.
No ringing?
No.
So I'm just going to have a look to see the drum. That's good. Let's see. Sometimes, obviously, wax is one of the risk factors, but you...
She said my eardrums were scarred or something. But...
Possibly, on the left, but not anything significant. So there is no wax there at all. So I will refer you to audiology, which is an NHS thing.
Okay.
So I'll do the referral, your prescription. Main thing is to check your medicine, so, okay? Take care. I'll see you. Bye-bye.
Bye-bye.
I need somebody to lie down and be unconscious. Right, I need you to head that way, please.
Your feet that way. On your back. Lie down on your back. You don't can't feel the legs halfway on you. Can you put your leg up? I'm now going to bend the knee of the furthest leg till the foot's flat on the floor. Oh, you are unconscious. Foot on the floor and then toes behind the other leg. Hold the leg upright. So if you let go of the leg, it's flopping sideways. If I let go of your leg, it's flopping sideways. Hello, leg.
I'm unconscious.
You got rigor mortis by the looks of it, a bit late.
I thought I was dead.
No, you're not dead. You're alive. We're saving you. How can I help?
It's to do with my periods. This is the 4th time now I'll have been here about it.
Okay.
The last time I came, they did hormone tests because I've got hemochromatosis. So I questioned, is that causing early menopause for me? So they did the hormone test, which came back apparently clear.
What prompted you to have the hormone screen in the first place? So was it that you were
It was
missing
questioning that I had a week of just brown discharge.
Okay.
Then 4 days from that,
Yeah.
nothing.
Right.
Then I had what I would classify as a normal period.
Right.
Yeah, and things
So they were
like
a
this
bit
have
sort of
been
erratic,
going.
yeah.
Yeah. I am now bleeding a lot during intercourse and afterwards. Yes.
Oh, okay. And is there pain on intercourse as well? or-
No pain on intercourse, but I did after. Yeah. Like an ache, like a period pain, really bad, dull period pain afterwards. Then today, I've had another big bleed about an hour ago, and I'm now quite concerned.
I take it you're not having your periods anymore?
No.
Okay. So when did your periods stop? Have they stopped?
I think probably the last time was just less than a year ago. Because I'm busily going, yeah. And then they come back and I go, oh.
You just described one of the disadvantages of the progesterone-only pill. It doesn't regulate your periods, and that can be a bit of a nuisance, can't it?
It can when you're sort of, your lifestyle's like mine.
Yes.
I'm never doing the same thing at any one time.
Yes.
Do you still have periods?
Why, you're pregnant?
No.
Are you having any other symptoms? No mood swings? Should we ask the family that one?
If you just raise your shirt up for me and just show me the lower part of your tummy. Is there any pain in the tummy at the moment?
No, none. Okay. I did earlier today, but that came and went.
Okay. All feels normal. Just pop your t-shirt back down. We'll have a chat. I mean, there's a few things we need to rule out as a cause for this bleeding. So bleeding, particularly after sexual intercourse, the commonest causes are sexually transmitted infections and sort of polyps or little growths on the surface of the cervix. Yeah. And then there are obviously more sinister causes that can sometimes be at play. So certain types of cancer in the cervix and in the womb. I think a good place to start would be to do some blood tests, including something called a CA125, that gives us an idea of the likelihood of there being something wrong with the ovaries.
Oh, okay.
If it's positive, it doesn't necessarily mean that there's definitely something wrong. It's not a diagnostic test, but it kind of gives us an idea of likelihood. We'll also check some other routine blood tests, but also we'll organise an ultrasound of your pelvis.
Right, okay.
Okay, and that'll have a closer look at your ovaries and at your womb. So you were mentioning fibroids, for example.
Yeah, so
you know.
that's what I'm hoping. I
Yeah,
think.
yeah. That'll investigate any potential problems like that. I guess the last thing to consider is a speculum exam, similar to when you have the smear test done. That would be useful in terms of just doing some swabs and making sure that we're not dealing with any potential type of infection. I think it's unlikely, okay?
Yeah.
From sounds like you've got a stable sexual partner,
Yeah.
I think that's still worth doing. Obviously, in the meantime, if the bleeding comes on, becomes heavier, and you start getting short of breath, and you start having any abdominal pains, or you're passing, large clots or anything like that.
Yeah, no, they're only
come back
very
and see
small at
us.
the moment.
Yeah.
It's only very small.
They come back and see us,
Okay.
and we can take things further.
My main concern in Victoria's case was to rule out any problems with the cervix or the neck of the womb. The main things that were going through my mind were, number one, infection, but also potentially more worrying causes like cancer. After I saw the patient, we called her back and I referred her to a specialist clinic where they will perform a procedure called colposcopy, where they have a closer look at the cervix under a microscope. Is that okay?
Yeah, thank you.
You're welcome.
D-I-A. I think I've spelled it wrong, right. If I haven't spelled diarrhea right, it's not my fault.
D-I-A, run, run, hurry, or exploding arse. That's how you spell diarrhea.
Lorraine Ward. Hello. It's Dr. Hyder. Come through and have a seat. How are you?
I'm fine. This is, I've got this rash here.
Okay.
That's been going on for months.
Okay.
First of all, I thought it was like an allergic reaction to something.
Mm-hmm.
But I've been taking antihistamines and using creams and that, and nothing's budging it. And this has been on for about, I'd say about 4 months. On
Okay.
and off.
Itchy?
No, not itchy at all. No.
Do they become red?
They do become red.
All right, can I take a closer look?
Yeah.
Yeah, they look like little, like vesicles, like little tiny round...
What reminded me of a
spots.
chicken pox.
And you've got quite a few dilated blood vessels across the nose.
It's just
there.
really affected my whole face.
Have you noticed that the dilated vessels are a new thing, or have they been there for a while?
No, I've always had them, but they've got worse.
Yeah.
And also underneath my eye as well.
This looks like something called acne rosacea. Have
Okay.
you heard of that at all? Okay.
Right.
So it's not like the acne you get as a teenager, but
Right.
typically it comes later in life, and
Right.
it can be related to flushing. So you
Right.
feel hot and you can get like a red flushing colour across your nose and cheeks
Yeah.
and forehead and
I
chin
do get very hot,
sometimes.
especially at work.
Okay.
All of a sudden I just get, I mean, obviously I'm coming to the age now, I'm nearly 50.
Okay. And often you can get little spots that look like acne,
Yeah.
but you think it can't be acne because you're not,
Yeah,
you know,
exactly.
the age to
I've
get
never,
acne.
never suffered from acne.
We usually treat it with an antibacterial gel that you apply just on the affected areas for 8 to 12 weeks and see how that goes. And sometimes it can make you more sensitive to the sun. It can be genetic, so is there anyone that you know that's had it, parents
No,
or
not
anyone?
as far as I'm aware. Is it something that's going to be ongoing or something that will probably clear up with the gel?
I hope that it will clear up with the gel.
Yeah,
but
me
we'll
too. It's
see.
quite unsightly sometimes.
Okay, so you've been worried about the appearance of it
Yeah,
as
well,
well.
you know, it's embarrassing, isn't it, when people, you know, staring.
So this talks a bit more about it. So at the
Yeah.
start of the leaflet, it talks about what are the symptoms. So frequent flushing, redness, small lumpy red spots, tiny blood vessels visible.
Yeah.
And then it talks about who gets it.
Okay.
Typically appears in your 30s to 60s.
Right.
So that's the leaflet for you to have a look at.
Lovely,
Okay.
thank you very much. Thank you.
Take care then.
All
Bye.
right.
I went to bed early last night, but then I put Shrek 2 on, and I just ended up watching that.
Shrek 2? Do you know what? My daughter's just had a baby and she's only 11 weeks old and she's been watching Frozen with her every morning. Oh, she loves it, Mum. I went, no, you love it. I do like Shrek though. And I still like Scooby-Doo as well.
Scooby-Doo.
I love it.
How can I help?
Well, I don't know. So they've been having blood tests because they said something about my kidneys.
Yeah.
But I've got no symptoms.
Yeah.
I feel as right as ninepence.
Yeah.
Never felt bad.
Yeah.
My biggest problem is weight.
Yeah.
So I don't know what's going on.
Okay. So do you know why we've been concerned about your kidneys?
Something to do with keratin or what, or carrots or whatever.
Creatinine, yeah, nearly. We did some blood tests and we noticed that actually your kidney wasn't functioning as well as it had been. So it looks like we've been keeping an eye on them with blood tests and we've tweaked your medications. I think we've stopped the
water tablet.
But we've kept you on the other one for your blood pressure. Losartan, yeah. It looks like your kidney function has improved slightly,
Slightly.
Slightly, yeah. It's certainly not back to where it was a couple of years ago, that's for sure. What I wanted to do today, because you've been off your water tablet for a couple of weeks now, haven't you?
Been getting on for that, yeah.
So we'll check your blood pressure today, see how it's holding up. The other thing we ought to probably do is get a urine sample, because sometimes when the kidneys aren't working as well, they start leaking protein into your urine, and we can pick that up. We can send it for a test. And then we need to kind of make a plan, okay? So let's do your blood pressure first.
Right. Well, that shouldn't be very good, because what with the blinking traffic...
Stress you out a bit.
Oh, you're not kidding. Coming through that train.
Nice deep breaths.
And no talking.
Yeah. Okay.
How is it?
It's high.
I thought it would.
Yeah. This is something we need to keep an eye on. There's two things. We need to keep an eye on your kidney function, but we also need to think about what we're going to do with your blood pressure.
You're not going to give me any more drugs, are you?
Well, so that's what we need to decide on. And
well, let's just try it without drugs, huh?
That's fine. That's fine. I'm not going to be in a rush to start something.
The less drugs I take, the better I feel.
Okay. So we have to balance the risk of obviously making your kidneys worse versus your blood pressure getting uncontrolled.
Yeah.
Because that's also a situation we don't want. What I suggest we do is we can get the urine sample sent off. They can book you in for a blood test on Monday.
Another blood test?
Yeah.
I'll have to come in for a transfusion, I will.
In the meantime, I'll speak to the kidney doctors at the hospital just to get a second opinion on this. Yeah? So I won't add any more medications today.
No.
But obviously keep an eye on your blood pressure at home. Let me give you that bottle and the form to take with you today.
Okay.
There you go.
Yeah.
That's the bottle and the form.
Okay.
So once you're done, put it all in this bag and hand it in.
To the girls. With this form, yeah?
Yeah, with that form.
Okay, then.
We'll see you then.
Yeah, that's fine.
All right.
Thanks very much.
Take care.
Bye-bye.
She found out that your pulse was irregular, further to which...
There isn't much of me that's left regular these days.
It feels like someone's sitting on my chest, and it lasts until late morning.
Yeah.
It's a good thing, that healthy heart club.
Yeah?
Yeah.
Quite enjoy it.
Every Wednesday we go, don't we?
In terms of normal heart's beating, it'll be like this.
Yeah.
It's like a little gallop of the heart. In your heart, it is doing this.
Oh, the other one's playing Morse code.
That's good. Sounds like a little horse, doesn't it?
I was just so pleased that he's actually got a heart.
Come in. Have a seat. Over here.
Oops.
Can I help you? This one?
Yeah, no worries. Oh, got it. Yeah, got it.
That's good. How are you today?
Oh, not too bad, mate. Not too bad.
How are things currently?
Well, I was getting some, pains in the side of the head. Felt like I'd been punched. But, I mean, that's gone. But I'm still getting probably twice a week a dizzy spell.
Okay. Do you get any other symptoms or palpitations or chest pains?
I just kind of have a wobble.
Any other previous history of heart problems in the family?
Yeah, my dad, he had a few heart attacks.
Mm-hmm.
And I think his father, he died at 46
Okay.
of a heart attack.
Mm-hmm. Let's have a quick check on you.
Should I take my jacket off?
Yes, please. Thank you. I'm aware that you're registered blind. How much can you see?
I have a very, very
narrow tunnel
field of
vision.
vision, but my central vision is very blurred.
Blurred.
So I can kind of see you, but I couldn't describe your appearance.
Okay. I'm just going to quickly listen to your chest.
Okay.
That's great. Thank you. It's all very normal beats. Take some nice deep breaths. Perfect. Thank you. The heart is beating pretty normally now, but looking at results here, there was just one episode of 8 beats of irregular beating, which means when you had that episode of dizziness and feeling wobbly, that's when the heart was beating in a rogue fashion.
Right.
If the same gets prolonged for more than 30 seconds, then the heart starts to completely fibrillate. And you'll have collapse, and sometimes some people have sudden cardiac death as well.
And how can I help you today? Is it your eye?
Yeah, I woke up like it. It was quite like, sort of like pussy almost. But I just thought, oh, it's a bit of sleep. Then I looked in the mirror and I was like, oh, okay.
Hello, little one. Is that shiny?
Okay. The vision in my right eye is completely deteriorated.
Okay.
I mean, I can see, but there's no sharpness in it.
It's dry over here.
Yes.
Ah,
Okay.
a tear coming.
The tear's coming. Okay.
Looking at results here, there was just one episode of 8 beats of irregular beating. So we need to nip it in the bud, get further more testing. We call it as electrophysiological studies. Hence, I need to refer you to the cardiologist.
Okay.
Any questions today? Are you okay with the explanation?
Yeah, is it okay to carry on as normal, yeah?
Carry on as normal. However, you probably would be better off staying away from any danger like water, fire, those sort of things. Yeah.
No, see, I do a bit of weight training.
Okay.
Am I okay to carry on with that?
I would advise you to stop lifting any heavy weights for the moment until you see the cardiologist. You can still keep active, but no strenuous activities, that's what I mentioned. Yeah. Okay?
Yeah.
That's your...
cane, okay. Oh, thank you, sir.
In the meantime, if you develop any further worsening, like chest pains or palpitations, you need to come and see me.
Yeah, all right then.
All right.
Thanks.
All the best, sir.
Thank
Take
you.
care.
Take care.
Bye-bye.
Out to the left, isn't it?
Yes.
David's mother had 3 children. April, May and...
June.
What about David?
Come right in. Good. So this is Aaron. What can I do for Aaron?
Poorly, bless him. Firstly, he keeps rubbing his ear.
Right or left ear, or do you know which one?
A bit of both. So
Okay.
I did think it was just because of teething.
Yeah.
But looking at it this morning, it looks very waxy at the same time.
And how long has he been rubbing his ear?
Oh, ages.
Okay.
And then his breathing's just atrocious at the minute.
Any family history of asthma or anything like
Only
that?
my brother, possibly his older brother.
You mean Aaron's older brother?
Yeah.
What age is he now?
He's 6 now.
Okay. Is he eating okay?
Less than usual,
Yeah.
but he is
He's
still
eating,
consuming,
yeah. And his bowels and his urine and so on, they're all okay?
Yep.
So just going to look in your ear, Aaron, now, just to see what we can see. That looks pretty good.
The other one.
Okay.
It's a bit gooey this morning.
Doesn't it look a bit gooey? Yes, it is a bit gooey, you're right. What's in there is debris, it's dead cells, and the body responds to infection by oozing.
Okay.
So it's that ooze, it's dead cells, it's some pus cells from the immune system to go and fight the infection. Now let's listen to his chest. He's obviously a good grubber. He eats well.
Yes. Which is quite unusual because at the minute he is being quite a fuss pot, but he does
You've
normally
been a
like...
bit of a fuss pot. You a good boy?
He is generally a very good boy, just
Yeah.
last couple of nights have been extremely hard. I think we've had about 2-3 hours sleep per night.
All right, yeah. And we just want to see his throat. So just one arm around his arms and one arm around his forehead. That's right, I know, but don't you worry about it. That's it. Yeah. So he has an infection in his chest and an infection in his throat and an infection in his ear. But he's also a bit heavy.
Am I feeding him too much?
I think so, yeah, I think so. It's not always easy for a doctor to raise the fact that a child is overweight with the parent because there's an implied criticism or the perception that the doctor is criticizing the parent when that isn't the case. The doctor has an obligation to draw to the parents' attention any problems that are being stored up for the future.
What can I do about his feed? Because even I know for a baby he does feed a lot. So he'll have breakfast milk, lunch, dessert milk, dinner, dessert milk.
Yeah. I think just begin to restrict the amount he takes of each food. So put out less for him. And less feed, maybe dilute the feed slightly so you have the same volume but just less food in it, just miss out a scoop.
Okay.
And then of the solids, just give him smaller portions and just gradually restrict it that way in a way that he won't notice.
Okay.
Yeah, because he just likes his food and some of us do. And, It is okay to deny a baby food when they're taking or getting more than they need. There are times when you have to take that bottle away. There are times when it's better for the baby or the child to take that plate away. The body wasn't designed to use excessive calories in any sensible, healthy way. The ear drop, I want him to take 3 drops into the right ear for 10 days.
3 drops right in 10 days.
Yeah, it'll all be on the thing.
Thank you so
I'm sure
much.
you will.
Thanks a lot.
Bye-bye, Aaron.
Say bye.
Bye-bye.
Bye.
Bye-bye.
Brilliant. Thanks to you.
You're welcome. Nice to see you. Bye.
Take it easy. Bye-bye.
Thank you very much.
You're welcome.
Say bye, Andre.
Okay, thank you very much.
Take care. Bye.
Thank you.
You take care.
Thank you,
okay?
Dr. Bolger.
Thanks a lot.
Take
All right,
care.
then, take
Thank
care.
you.